Hello, my name is Tamon Konakon, or you can also call me Rosie. And today we're going to be talking about what is PrEP. And with our special guest today, we are here with Dr. Nat. สวัสดีค่ะ
สวัสดีค่ะ
Can you please introduce yourself for the audience?
Hi everyone, my name is Nat. I'm a pediatrician at Chulalongkorn University and I work with adolescents at risk of HIV and I give HIV prevention services.
Alright, so what is PrEP?
So PrEP stands for a medicine called pre-exposure prophylaxis, which is a medicine that can be taken to prevent HIV.
Is it well known here in Thailand?
I think in some circles I would hope that it's fairly well known because we've tried in the last few years, since it has become available in 2014 worldwide, we've tried to promote it as a method that people can use in addition to condoms and other methods to prevent HIV prevention.
So PrEP only prevents, so it's like a prophylaxis that only prevents HIV?
Yes.
And how do you take it?
So it's a tablet, it's about this big and you take it once a day. And you take it during periods where you think you may be at risk of contracting HIV. And so some people will feel at risk if they have a partner that doesn't want to use condoms, or maybe they go out partying and they may get drunk on alcohol or drugs. Some people have an HIV positive partner who has just started treatment and they want to have a child, and it's another way that people can have children without passing HIV onto the child.
So it's like a protection. So it's similar to condoms, do you say, or it's not?
So yeah, you could say that. Some people call PrEP chemical condoms because they prevent HIV. But what is an important point I want to make is it only prevents HIV. It doesn't prevent other sexually transmitted diseases like gonorrhea or chlamydia or syphilis.
So would you still recommend people to take PrEP, even though there are sort of some, compared to condoms, they protect STDs and also other stuff. Would you say PrEP is better, or you would still recommend them to use condoms?
It's a really good question that a lot of people ask, and my answer is always, it really depends on what you think suits you. And so it's like if you're a woman and you don't want to get pregnant, you're not ready to have a baby, and there are loads of different options that you can pick, and everybody will pick what is best for their lifestyle. So if you're trying to pick contraception, you may use the pill if you want to come off the pill quickly, or if you're somebody that doesn't like taking tablets every day, you can use an implantable device. And so PrEP is the same. So you can use condoms, you can use oral sex instead, or you can use PrEP, or you can use all three. And so the more different tools that you use to prevent HIV, the lower your risk is for getting HIV.
So who would you recommend PrEP to?
So I'd recommend PrEP for anybody who feels that they may be at risk for getting HIV. And in Thailand, the groups of people who are most at risk of HIV are men who have sex with men, transgender women who have sex with men, and anybody who has an HIV positive partner who has just started treatment. So in what we call may not be virologically suppressed. So in other words, their virus is still high because they've just started treatment.
Is it easily accessible?
It's fairly easily accessible now. So since October 2019, the Thai government has actually rolled out PrEP nationwide. So you can access it at a selection of government hospitals around the country. You can also access it at a lot of Thai Red Cross clinics. There's one in Lam Kam Hang called the Rainbow Sky Association of Thailand, and there's also Swing, which is another NGO, and they have branches in Pattaya and also in Pat Pong in Bangkok.
Oh. So, um, so, 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 If you were, so would you say that PrEP is sort of similar to contraceptive pills in the sense that, like, contraceptive pills prevents you from getting pregnant and PrEP prevents you from getting HIV?
Yeah, something similar to that. And of course, another question people like to ask is, well, how many percent is actually going to protect me? And that's also another very good question. And the protection is around 92 to 100%, depending on how you take it. And so, like contraception, it only works if you take it. With PrEP, it's the same. If you take it, it works. And so you have to take it on time, once a day, every day. And if you do take it, then with condoms, the prevention is nearly 100%. And so for a lot of people who are deciding, oh, should I take it, should I not? I always tell them, and I said this to one of my clients yesterday, that you have to balance the scales. And so the downsides are you have to take a pill every day, and some people get side effects of dizziness. If you have problems with your bone or your kidneys, you may not be able to use it because it's a side effect of a medication, but that's not very common. But if you balance that with an infection that you will not be able to get rid of, that you will have to be on medicine for the rest of your life, which is worse, and decide from there. So usually when people come to our services to ask for PrEP, I will always give people the information and give them the freedom to decide whether or not they want to take it. Because some people will be scared and say, well, if I take it, then I'll have to take it for the rest of my life, right? And of course, the answer is no, because it's not a treatment, it's a prevention. So if you're going through a phase where you think you may be at risk, you can take it, and when you're not at risk anymore, you don't have to take it anymore.
Okay, so they can actually get them from any governmental hospital, but they don't sell it in pharmacies, though.
That's another very good point, yes. So it's not sold in pharmacies, and the reason for that is if you take PrEP, if you've already been infected with HIV, that can cause drug resistance. And so we always check people for HIV, and we also check their creatinine. So we check their kidney function for safety before starting PrEP.
Okay. Do you have any words you want to tell people who are deciding whether or not they should take PrEP or anything?
I think that there are a few things to consider. Number one, do you think you can take a tablet every day? Number two, what are the alternatives? Can you use condoms, or if you can't use any of them, could you live with a life of living with HIV? Think about the side effects. The good thing in Thailand is you don't actually have to pay for the cost of PrEP or the cost of blood testing, and so that will probably factor in. Another thing to think about is if you're on PrEP, you have to come in for blood testing every 3 to 6 months. And if you're coming in for testing anyway for general health things, then it may be worth doing it. And at the end of the day, I think that people find it difficult to make a decision based on just what a doctor says. A lot of people are more comfortable with speaking to somebody who's had the real life experience of being on PrEP, and there are plenty of places on the internet. You can go to the Facebook of the Thai Red Cross page or an NGO called Love Foundation, and there's plenty of chat rooms where people will talk about their experiences, and then you can decide from there. And I think that ultimately you can always change your mind, because it's not treatment. You can try it, and if it works, it works, and if it doesn't, then you can stop it. But always keep in mind that it's an option that is available to you to help you have a better time when you go out, and also just to stay safe.
Thank you so much for your talk today. ขอบคุณมาก
ขอบคุณค่ะ
Okay, so I hope you learned a lot about PrEP today, and thank you. สวัสดีค่ะ